My daughter's doctor kept dismissing her pain as drama because she's a teenage girl. Now we know she had a brain tumor. I always trusted doctors. I believed they took an oath to help, to listen, to care for every patient equally. That faith died the day I learned my 16-year-old daughter Emma had been suffering in silence for 8 months. It started with headaches. Emma complained they were getting worse, affecting her vision, making her nauseous. I took her to our family doctor, Dr. Martinez, 3 times in 2 months. Each visit, he barely looked up from his computer. Teenage girls are dramatic. It's probably stress from school or her period. Take some Ferninol. When Emma started missing school because the pain was so severe she couldn't focus, I insisted on further testing. Dr. Martinez sighed like I was wasting his time. Look, Mom, I've been doing this for 20 years. Girls exaggerate everything. She's probably just seeking attention or trying to get out of exams. Emma sat there, tears streaming down her face while he dismissed her pain as performance. The 4th visit, Emma collapsed in the waiting room. The nurse held her to a chair and asked if we wanted to reschedule. I demanded to see the doctor immediately. Dr. Martinez walked in, took one look at my pale, trembling daughter and said, "Still, with the headaches, maybe you should consider counseling. Sometimes psychosomatic symptoms. Run a CT scan," I interrupted. "That's unnecessary and expensive. Insurance won't cover it for stress headaches. Then I'll pay for it myself." He actually rolled his eyes. "If you insist on wasting your money, I'll write the order. But I am telling you, you won't find anything." The tech who ran the CT scan went quiet halfway through. She left the room, came back with a radiologist. They whispered, pointed at the screen, whispered more. 20 minutes later, Dr. Martinez burst into the room, face white as his coat. "We need to get Emma to the hospital immediately. Here is a mass in her brain." 8 months of calling her dramatic, and my daughter had a brain tumor pressing against her optic nerve. The neurosurgeon at Children's Hospital was furious when he heard our story. "This tumor has been growing for at least a year. The symptoms she described are textbook signs. How did your doctor miss this?" The answer was simple. He never looked for it because he never believed her. During Emma's surgery, Prep 3 nurses separately told me they see this constantly. Young women, especially teenage girls, have their pain dismissed as emotional or attention-seeking. They called it medical gaslighting. Emma's surgery took 7 hours. The tumor was larger than expected, wrapped around critical areas. If we'd waited another month, she could have lost her vision permanently. Dr. Martinez called after the surgery, his voice shaky. "I want to apologize. I should have listened. I should have taken her seriously. Should have," I repeated. 8 months too late. Sometimes we see so many anxious teenagers that we stop. I cut him off. "Don't you dare blame other teenage girls for your failure to do your job." The worst part, Emma apologized to me after surgery. My brave daughter, with bandages wrapped around her head, said, "I am sorry I kept complaining about the headaches. I thought maybe I was being dramatic," like he said. My child apologized for having a brain tumor because a doctor convinced her she was making it up. We filed a formal complaint with the medical board. Dr. Martinez's response was that he followed standard protocols for adolescent patients presenting with vague symptoms. Vague symptoms, a brain tumor is vague. Emma's recovering beautifully. Her vision is returning, the headaches are gone, and she's back to being the brilliant, vibrant girl she always was. But she's also learned a terrible lesson at 16, that adults in positions of power might not believe her even when she's telling the truth about her own body. Now my family thinks I should let it go and be grateful Emma's okay. They say pursuing the complaint will just cause more stress, that doctors make mistakes, but I refuse to let this slide. My daughter isn't the first girl whose pain was dismissed, and she won't be the last unless something changes. Tell me when a doctor's bias nearly cost your child her sight. Is seeking accountability really causing drama?